most common skin treatments that we do in our office is called BBL, and people often wonder what that is. Yeah, BBL is a broadband light device. The other term that is often used is IPL, or intense pulse light. Our particular device has two flash lamps. It's a broadband light device made by Cyton. And what this does is it produces, in a way it's kind of like a laser, in that, except that how the light is produced is with very, very bright flash lamps. And then we use filters so that the frequencies of light that we don't want to come out through our device handpieces is filtered out.
It finds pigment, it finds areas of redness, and it finds water within the skin. And this means it can effectively treat things like, sunspots, pigmentation, broken blood vessels and capillaries that we can often find right in the nose. And we do see these little things, I suppose, increase as we get older or after the summer.
There's also ways of using it to treat acne. We can use broadband light to generate heat in the dermis of the skin to allow for some tightening of the skin. So there's a technique that we use in the neck called Skin Tight, which uses the broadband light device as well. So it's a very versatile machine. It's very busy in our clinic. People seem to be using it very, very frequently because it works very well.
It also can do a really nice job at fine lines and pores. So over a course or a series of treatments, you can see a really nice reduction in kind of acne scars, pores, and fine lines.
So one of the questions is, who's a candidate for broadband light treatments? It really depends on numerous things. So obviously we want to have irregularities in the skin that can be treated. So pigment, vascular lesions, maybe crepey skin in the neck. Those are the things that broadband light is generally helpful for. Now, keep in mind that when we're applying the broadband energy or the filtered broadband energy to the skin, we want that energy to target the areas that we don't want. So we want it to target little bits of pigment. We want it to target little blood vessels. So you don't want someone who's got a tan, because then the entire skin is going to get targeted by the BBL device, and that could lead to someone having a burn. So a lot of our BBL patients are asked to stay out of the sun, to not have a tan when they come in for their treatments. So I think it's important to examine someone's skin and take their history, making sure that they haven't been exposed to sun or that they're not using medications that sensitize their skin. There are some antibiotics that do that. So I think it's important to get a thorough history and to examine someone's skin, figure out really what skin type they have before determining whether someone is a candidate. It's not just having something that can be treated with BBL, it's also, can you treat that problem in that particular person if they're on medications, if they've been out in the sun, etc. So it's very important when you're having these treatments that this be done at a medical clinic. I mean, these are very powerful devices. They work extremely well, but there are some risks with them. And so a thorough medical history, a qualified medical aesthetician really needs to do these treatments. And experience is invaluable. I mean, I think that's the one thing that I've learned over the years, is that as much knowledge as I have from medical school and from surgical training, there's nothing like doing this hands-on and learning from experience and learning from others who have experience. I think it's really, really important.